Welcome and thank you for joining us for this edition of Wellness Connection webinars. Today we're going to be talking about depression, anxiety, and medical cannabis, and we are joined by a very special guest. We're excited to have her with us. I am Becky DeCoyster, Director of Education for Wellness Connection of Maine, and also joining us is producer Ben, who is making the magic happen behind the scenes. And again, we are very happy to be joined by Dr. Carey Clark to talk with us about today's topic. Carey, you have a lot of initials after your name. Can you tell us a little bit about what they all mean and what kind of work you do?
Thanks, Becky. Yes, my name is Dr. Carey Clark. I'm actually a registered nurse with a PhD in humanities with a focus on transformative learning and change. Some of the other initials: I'm an advanced holistic nurse, board certified, and I'm a registered yoga teacher. I moved to Maine about 5 years ago to develop the RN to BSN program. So it's a nursing program at University of Maine at Augusta, and I'm an assistant professor there. And I'm very excited to be here and be able to contribute what I can as we talk about medical cannabis and depression and anxiety. And I think there's also a very big need for healthcare providers to be educated in this area. So I hope this information gets to them as well. And if not, people that are listening, feel free to share this with your providers and help get them educated. This is really a new and emerging field. The endocannabinoid system was only discovered in the 1990s. So many providers out there have not yet been educated in this area. And I'm excited for us to talk about this.
Well, fantastic. Shall we dive right on in? Let's take a look. So our first slide, we're gonna kind of take an overview of what we will be discussing today. And I thought this was interesting that, when we talk about depression and anxiety, it is a cycle, and that stress is a part of the circle as well. And so we have the cycle set up here. Dr. Clark, can you tell us, can this start at any point in the cycle? Do I have to be stressed to get anxiety? And if I have anxiety, am I going to have depression? Let's chat a little bit about that.
Sure, Becky. So I think that's a really good question, and I think they are all very interrelated. So some people start maybe feeling a little depressed, and I often think of the folks, as you mentioned earlier, seasonal affective disorder can feel like depression as well. But what we find is that people that are depressed are also stressed. And when you're depressed and stressed, you tend to have anxiety as well. But really, you could start at any one of those areas in the circle. People that have a lot of stress, there's physiological changes that happen in their brain and what we call the psychoneuroimmunological system. And that can create more stress and can create changes in how they cope as well. And that can lead to depression and, of course, anxiety. So the three are really very interrelated. And I love the little graphic that you have there as well. And sometimes, though, people that are depressed, and I've seen this quite often, it will just show up as anxiety. So people that have a lot of anxiety most likely also have depression, but their main complaint might be anxiety.
And yeah, as we're seeing the little reveals go around the circle, I mean, I think that we hear from our members a lot. They'll come in and they are stressed, either because they are sick, they are having limited mobility. On top of caring for themselves, they may have family responsibilities, and then of course that can lead to fear about the future and panic, and then it can become all very overwhelming. So I think if folks are feeling these sorts of feelings, actually let's talk about that. If I am aware that I have trouble falling asleep, or maybe I don't want to get out of bed, what are the first steps I should take to address that?
Well, really, I think if someone's feeling so overwhelmed that they can't get out of bed, they need to make an appointment with their primary care provider and talk about what's going on with them. Um, Unfortunately, again, primary care providers are often not well educated, at least in the use of medical cannabis. So that's kind of the place to start. And I think we're going to talk about further in the presentation, though, how medical cannabis can be really a place that, or a sacred herb, we might call it, that can help address a lot of those issues that you had showing on that previous slide. But we do want people to also have a good diagnosis so they know what they're dealing with. So that really is the place to start. And then taking it from there, doing their research on the medications that are available, and also possibly how medical cannabis might help as well.
So silence is not the way to address these things. I think a lot of times we don't talk about it. I do want to point out the second or bullet point here. Anxiety and depression alone are not qualifying conditions in Maine for the use of medical marijuana. And so that's an important thing for a person who is experiencing these things to realize. It's an important fact for physicians and healthcare providers to realize. There can be associated symptoms such as pain, which do fall into the list of qualifying conditions. But as of this point, they are not standalones. And that's the third point here. These issues are side effects of many of the ailments. When you're dealing with a serious illness, when you're dealing with chronic pain, anxiety and depression can come with that. And in fact, as we start to move into talking about what's happening in our bodies and how that affects our minds and our realities, many of our members who suffer with post-traumatic stress tell us that it is not until they start using low doses of medical cannabis that they can get themselves into a mindset to accept the help that is out there. And I think that's an important thing to discuss and realize as well.
And I did want to say, too, that I think PTSD is really highly underdiagnosed in our culture and our society. You could be in a car accident and maybe even think it's not that big of a car accident, and you could end up with PTSD. And so I think, if someone is depressed and really looking at the list of qualifying medical ailments and seeing, and again, working with their primary physician and or seeing a doctor that specializes in supporting the use of medical cannabis and is able to write the prescription to really figure out how their various ailments are related. And I think this next slide, you really start to get into that as well. So.
Yes, and I was hoping that you could provide some illustration and some explanation of how this is all happening. But there is a lot of crosstalk happening when we're feeling these different feelings. Stress, one symptom or manifestation might be raised blood pressure. Anxiety, obsessive thoughts, depression, you're feeling apathy and fatigue, and those play into each other. Is that correct? And can you tell us a little bit more about what might be happening?
Right. So when people are stressed, they start firing from the amygdala in their brain, and that releases cortisol, and the whole body goes into what we might call a stress response. And so, of course, blood pressure goes up, heart rate goes up, all kinds of changes happen in the body. And you may have heard of that before as the fight or flight reaction. And this is it's a great mechanism. We all need to have the fight or flight response at certain times in our life. If you're out there in the Maine woods walking around and suddenly there's a big bear and you are not a hunter and you don't have your gun, and maybe even if you are a hunter and you do have your gun, your amygdala is going to start doing its work, releasing that cortisol and get you moving out with that fight or flight. The problem that we have in our modern culture is that most of our stress is psychological and emotional versus physiological. And so we have these things that tend to trigger us, and there can also be things in the environment, the food we eat, the different things that we're exposed to in our environments, like chemicals, can put us into stress response as well. And when we're doing that, we're firing from the amygdala, it becomes really difficult for our brains to, particularly if we do that a lot. So if we stay in stress a lot, that amygdala actually grows, and it can kind of become the driver of our responses. So we can end up being in stress response way more than we need to, and we can get kind of stuck in that constant response. So we need to do things that bring us out of stress on a daily basis as well. And those sorts of things might be exercise, meditation, yoga, things that help to fight that and that help to activate what we would call the parasympathetic nervous system. And that helps to get the amygdala to stop firing so much and gets a biochemical transmitter released called GABA as we move into what we might call relaxation response, or the parasympathetic nervous system acting. And that's released from a different part of the brain. Primarily we think of the cortex and the prefrontal cortex. So again, what happens though is people get into this whole stress cycle, and if they're not doing things to go into relaxation response and activate that parasympathetic nervous system, they can end up with these, more anxiety, like you have here, the obsessive thoughts. And then, of course, eventually the body just gets really worn out. That cortisol circulating throughout our bodies just wears us right out and can do damage to the adrenal and can also, I believe, and I think there's, still a lot of research to be done in this area, lead to an endocannabinoid deficiency as well. So.
Thank you for that, and I think that that is a lovely segue into the fact that cannabis can help with each of these issues or conditions. This is just one study that was fairly recent. There are many others. If our listeners are not aware of it, there is a fantastic website called PubMed, and that's just P-U-B as in boy, MED as in Daniel.com. And this is a clearinghouse of scientific research that is made available by the National Institutes of Health. And you can go in, it's very easily searchable. So you type in cannabis and stress or anxiety or PTS, and you'll see some of the recent research on it. This particular article out of the University of Buffalo talks about the endocannabinoid function helping to stabilize mood, helping to ease depression, and I think it's interesting. You mentioned the endocannabinoid system and that it has only recently been discovered in scientific terms, the 1990s or the blink of an eye. Can you give us a little overview of the endocannabinoid system and the role that you believe that it may play in these issues?
Well, it is a system in our body, and almost every cell in the body is affected and has this system in place. So, but particularly the brain and then the immune system. And to put it really simply, so of course people can go out and do research, but our bodies are made to make their own, what I would call cannabis-like chemicals. And what could happen when we're stressed a lot is that this is interfered with and can cause all kinds of problems with our immune system, can lead to inflammation, can lead to disease and illness. And so, I've done a whole lecture on this that I developed actually for the American Cannabis Nurses Association. So we could spend a long time talking about that. But just know that I think the most important thing for folks that are just starting to get into this and learn about it is that our bodies are really aligned to accept cannabis as a medicine that helps us to heal. Both our brain functions and our immunological functions. And that's kind of the very simple way of looking at the endocannabinoid system.
And I think our bodies want to be in balance. You know, we want to be in a homeostatic state where things are balanced and flowing, and the endocannabinoid system is intricately involved in maintaining that homeostatic balance. So, and here's something that we do here. Doesn't cannabis make depression and anxiety worse, not better? We think of all of the stereotypes of people who use cannabis and they're, you know, melted into the couch, or, and we do hear this from some of our members who perhaps had recreational experience before they became a medical consumer, that they are hesitant to come back to the plant because it made them paranoid. It made them very anxious. And so I thought it was important that we address that. And you have touched on the GABA protein interaction that specifically the THC molecule has in stimulating the parasympathetic nervous system, correct? And so the result here is increased enjoyment, motivation, memory, and attentiveness. I want to talk about two things here. Number one, THC versus many other compounds in the plant, and any advice that you might have for somebody who does have a negative experience in their past, and your thoughts on how they might approach trying this as a safe, natural therapy. So.
Okay, well, I think, you know, I agree with that. I think many people in the past may have had those negative experiences. So I think the science around cannabis is really growing, and we're now able to test the cannabis that people are receiving, and one, so that you know that you're getting a safe, quality product, and that is really important. But also, and I think we're going to talk about this in the future slides here too, finding a strain that works for you. And the strains have changed a lot. If somebody hasn't used, you know, they used cannabis recreationally 20 years ago, it's we're looking at a completely different world now of strains and medicines in the world of cannabis. So that is the good news, because there's more options and there are ways to figure out what works for you and what doesn't work for you. And that's where you work with, you know, the dispensary or your provider, talking about what your issues are, talking about what medicines they have available, finding out what has worked for other people. And then really so this is different than a lot of other medications out there, but maybe not so much when we talk about antidepressants, because people, when they take antidepressants, you know, sometimes they work, sometimes they don't work. Sometimes people go off one antidepressant, then they try and go back on it, and it's a completely different experience. People may, you know, end up taking multiple different medications in order to manage their depression. So in that way, I would kind of say cannabis is really not that different. Really starting with very small doses, being in very comfortable environments, I think, is important. Having support nearby. Knowing that you really can't overdose on cannabis is really important. For anyone who's ever felt like they've had too much, that's really where the paranoia can sink in, and you need to be around people that are supportive, and to not feel like you have to go to the emergency room or call the police or something like that because you've had too much cannabis. The main thing for that is to give it some time, eat some food, try and rest, stay hydrated, and know that as the medicine works its way out of your system, you'll return to sort of your baseline. So I think that's one of the most important things, is to know what medicine you're getting, that it's, you know, that it's been tested and it's safe, and to really go slow. People can also keep a little journal of what they're taking and how it made them feel, and they can also work with their dispensary or their whoever their caregiver is, I guess is the proper term here in Maine, to really make sure that they're getting the right strain that will work with them. Another thing that can happen over time too is that we can kind of get our systems sort of get used to different strains and that sort of thing. So sometimes people need to think about taking a break for a few days and then coming back to the medicine as well.
So we've touched on this a little bit already. THC gets, a lot of attention. It's probably the best known of the active compounds in the plant. It is also, as far as we can tell, the only psychoactive one. So if you are finding that a strain, for most folks, it makes them focused and maybe puts them in a better mood, and for you, it makes you anxious or paranoid. Step one, try using less of it, and then step two, you might want to look for a strain that has a lower THC content. And we're getting better here in Maine about knowing, being able to test our products for both potency and contaminants. But there are many providers in the state that can give you a good, solid baseline of, you should expect this level of THC in this product. So it really is about talking to your cannabis provider. And I just love this fact that, one of the natural cannabinoids that our bodies produce is called anandamide, and that ananda is the Sanskrit word for bliss. So it's there to bring joy, and moderation in all things is is not to be forgotten.
And you and I have talked about this before as well, but I think people can, in our culture, it's very interesting, people can sometimes be afraid of maybe feeling what we would call high or bliss, or feeling really good, or feeling just really happy. It's like, whoa, are people really supposed to feel that good and be that happy? And I think that's something that we need to begin to move beyond. In some ways, it sort of has become a stigma associated with this sacred herb and medicine. And so, allowing yourself to feel good, too, is part of the process as well.
I have to agree. And it can be scary, especially if your body has been in this stress state for so long. I think you're right. Maybe part of that anxiety or paranoia that some people may experience if they're, cannabis naive, is that fear of kind of letting go of all of that clenched energy and releasing that in ways that are healthy and helpful to you.
And I've also been reading a lot lately and hearing a lot, too, that some of that paranoia and anxiety comes from this idea that this medicine has been illegal. And it's like, are the police going to come get me? Is this going to hurt my job? Is this going to hurt my future? And those sorts of issues, too. So it's almost like this consciousness around this being a bad thing for so long in the past and in our history. And I think, of course, to help alleviate that, having your prescription or recommendation by your physician is very helpful. And maybe someday we'll move beyond all that. I think I foresee that in the future. But knowing that this is okay. This is a natural medicine. God didn't make a mistake. He put this here for us. So.
Well said. Very well said. So we've been sort of dancing around this, this particular topic, but there are so many different strains of medicine, and we don't need to do a whole, MMJ 101, but we should talk about strains, and we should also talk about indicas versus sativas, because depending on, your dominant symptom or the combination of symptoms that you have, you may find that one strain works really well for you and another doesn't, although it might for somebody else who also says that they are depressed. So I split it out here, stress, anxiety, and depression, and I included a strain for each of those that is likely to be helpful. This is not medical advice. Again, our endocannabinoid systems are different. Our individual responses to the plant are unique. But if someone came to us at WCM and said, I am, experiencing stress, or I feel anxiety, these are some of the first directions that we would look into. MOB is a very indica dominant strain, and so it will tend to have a more relaxing effect, and I don't simply mean mentally, but biophysically. Muscle tissue smooths, and there are some very good things that happen physiologically when we're using this plant. And then on the other side, if someone comes in and says, I am depressed, I don't have the will to clean my bathroom anymore, we would look initially, at least, more at the sativa family, and this is a little bit like red wine grapes and white wine grapes, I think. The indicas are the heavier, richer red wine grapes, and the sativas are the lighter, fizzier white wine grapes. So if it's depression and apathy that we're looking to treat, we would start probably by looking at those sativa strains, and Chocolope is one of many, many, many of those strains. So do you want to opine on that, or?
So I'm not an expert in strains. I do believe in people, being able to try and see what works for them. Another thing to consider is that balance between the THC and CBD. If someone's really having a lot of anxiety, sometimes a really high CBD strain can help with that anxiety, and they won't get that THC high type of feeling. And that may really work for them. But then maybe they're also having problems sleeping. So maybe they use a high CBD strain, a tincture or something during the day. But at night, if they're having problems sleeping, they might want an indica that's also a high THC strain to really help them get some good, solid sleep as well. And we do know, that cannabis is a great medicine for helping people to sleep. And many people in our culture struggle with sleep issues, and there's a lot of reasons behind that. Stress and anxiety, but depression can also affect your sleep. But also we spend so much time in front of our screens, and that blue light that emits from our screens really does a number on our melatonin, on our body's ability to release melatonin, which helps us to sleep as well. And I think all that just goes back to cannabis bringing the body back into homeostasis as well. So again, it's that starting with those low doses, finding the strains that work for you, and keeping that journal of what works for you as well.
And we should also remind folks that they will likely have a different reaction to the very same strain, depending on whether they are inhaling it or eating it or using it as a topical. A lot of folks find that while edibles have a longer lasting effect, many hours in many cases, and an ingested product goes through a metabolism that actually amps up the potency, and it doesn't do it immediately. You will maybe spend an hour and a half without feeling anything, and then suddenly it's overwhelming and too much. So another reason to always start with a low dose, and to be open to exploring and taking a little bit of time to find out the right strains, the right method of ingestion that really work for you. We have surveyed our members and found that the vast majority, I want to say almost 80% of them, are able to dial in the right strain and delivery method within 6 weeks of beginning with cannabis therapy. So,
and that's actually really great. I mean, if someone went with a traditional antidepressant, it would take 2-3 weeks usually minimum to get on board, and then is it really working for them? And also sometimes when it does get on board, and then if it's not working, some of those antidepressants, they have to wean off really slowly. So I don't really think we could compare the two systems, but just to say, I think that's great that 6 weeks is a reasonable amount of time to find a strain and a method that works for a person as well. And, I would also just say, people have probably heard this before, but just to be really cautious with edibles. I think oftentimes people think they taste really good, and it's been a half hour, and boy, that sure did taste good, and I'm not feeling much, so I'm going to have another bite or another whatever, and before you know it, they're in that space of like feeling as if they're over medicated. So just to be real cautious with that.
Absolutely. Very, very good advice. So I wanted to look at, I'm glad you mentioned, some of the other, some of the pharmaceutical treatments for anxiety and depression. And let's just look at, how they're operating in the body and what are the potential side effects. And we know that, for cannabis used responsibly, the side effects are going to be minimal. There may be red eyes, there may be if you're experiencing anxiety, you have that's probably a result of a mismatch between you and the right THC content. Dry mouth is a frequently reported side effect, but cannabis does not have the same level of tolerance developing. I mean, people don't develop a tolerance or a dependence on cannabis in the same way that they do for many of the pharmaceutical drugs. And you've touched on this already, but cannabis is non-lethal. They have done studies. You would have to consume 1,500 pounds of cannabis in 15 minutes to induce a fatal response. Now, certainly, if you mix cannabis with alcohol, that you can certainly do things that could have fatal consequences. But responsibly used, low dose, responsible use of cannabis is not going to be fatal. We can't say that for many of the other pharmaceuticals. Can you give us a little bit of an overview about these two other classes of drugs, the benzos and the SSRIs, and what side effects might we expect from using those to treat some of these conditions, Dr. Clark?
Right. So I'm glad you listed some of the benzodiazepines here. One thing about these is they tend to be highly addictive, and I would say that's kind of the biggest side effect there. They can also, sometimes people can have a paradoxical effect as well. So they may take the medication and it ends up acting sort of opposite in their body of how they would want it to act. And that's particularly true with our elderly population. So, we used to, even back when I became a nurse over 20 years ago, we used to give a lot of our elderly patients Haldol. And they'd have this, extreme paradoxical effect, and they'd get more agitated instead of more relaxed. So, but the benzodiazepines, as I think one of the biggest things to think about with them is that they are very addictive, and they cause, a dependence and changes in the brain that we didn't know about back in the 70s when we just started giving everyone Valium and Librium and all of those medications.
Question for you. So the benzodiazepines are typically used then to treat anxiety or agitation. Are these, I see that Valium is one of them, so these are the mother's little helpers, what we used to call them back in the day, yes?
Yes, they are the mother's little helper, and we really, and to be fair, we really honestly felt that they were helping the mothers. Motherhood is quite a challenge. I'm a mother to two beautiful daughters, and it's quite a challenge. My own mother was given Librium, which is similar to Valium, and there are value in these drugs too, and I can talk about that in a second too. But she ended up taking it for 10 years, and I think it really changed her brain physiology, and later on she had severe depression and a lot of neurological issues that I think were likely related to this long-term use of a benzodiazepine. So I think the benzodiazepines are best used like for very short-term situations. So if someone's going to have an MRI, giving them an Ativan or a Valium so they can relax and get through that intense experience would be a good thing to do, right? So we do have, appropriate uses for these medications, but it's really that long-term use for anxiety that is not helpful. So does that answer your?
It does. That's very helpful. Thank
you. Yeah, and I'm trying to keep it fairly simple and not get too much into the whole background around, but they also can be dangerous. I think you mentioned before alcohol with cannabis can be an issue. Well, alcohol with a benzodiazepine can be very deadly, and it can also just do a lot more damage when it's combined with the alcohol as well.
Just to clarify on that before we move on to SSRIs, the actual chemical combination of benzodiazepines and alcohol can be fatal in itself. And I think it's important to be clear that cannabis and alcohol used together, unless you are seriously over-consuming on alcohol, if there were any sort of fatal physiological action, it would be due to the alcohol and not to the cannabis, or to something that you chose to do while your thinking was impaired by the combination of the two. But in and of themselves, combining benzos and alcohol is it a central nervous system depressor, and so you essentially stop breathing? Okay, gotcha. All right. And then these SSRIs, and we see some of the brand names there. These are typically for depression. Okay, can we talk a little bit about those and how they compare to cannabis side effects wise?
Oh boy, well, these can have a lot of side effects. One thing that I think to really think about with the SSRIs, so the side effects can be, they can make you more sleepy, like a hangover type effect, or they can make you less sleepy, so you're not sleeping as well, but I think most people find they make them more sleepy. They can have kind of I would call this a side effect, but other people might say that's the effect of the medication, almost like a numbing type of thing that people can experience. So it's almost like it can be, they're not feeling depressed, but they're also not feeling much of anything. Loss of libido is a big one with the antidepressants. And one of the things that concerns me is many of these medications, I see you have Zoloft listed there, they need to be taken like around the same time every single day, and you can't miss a dose, or you could end up having confusion, lightheadedness, dizziness, and some serious issues, particularly with Zoloft. That has to be tapered very slowly over time to get you off that medication. Well, if someone's on it for, a week, they're probably not, it's just beginning to become therapeutic, so it's probably not going to be as big of an issue. But, most people are told you need to take this for at least 4 weeks and then continue on for, for longer to see if it's working. So one of the things that can happen with Zoloft, too, is that, again, it needs to be tapered extremely slowly for most people. Now, I've heard, oh, well, you just half the dose and half the dose and half the dose, and then, in a week or two, you're off it. But what I have seen and heard from people is that it can take much longer than that. There can also be lasting neurological side effects, particularly, so Zoloft is the one I'm most familiar with here on this list. I've read on some discussion boards and so forth, something called brain zaps. So the person gets off the Zoloft and or while they're tapering, it feels like their brain is being zapped by electricity, or kind of like it's bouncing around in their head a little bit. Yeah. It's not a seizure, but the person may feel like it's a seizure, and they call that a brain zap. Yes. And I think, side effects, so, and for some people they do work. So, I don't want to say that, don't ever try these, because for some people they do work and they allow them to function. Some people may not be able to take cannabis because their work won't allow it, and they're tested for medications and drugs, and their work still considers cannabis to be a Schedule I federally regulated medication, and so in that case they may have to use an SSRI. But what I would also like to say is that a lot of studies out there have shown that exercise, 30 to 60 minutes a day, done on a daily, regular basis, is as effective as the SSRIs at combating depression. So I would imagine that if someone was using cannabis and exercising, boy, they'd really have some good results at managing their depression and anxiety.
So let's talk about alcohol specifically, because I think that there are a lot of folks out there who are self-medicating. And here in Maine, we have actually just had one of our state legislators resign and take the time to manage his own relationship with alcohol. And I think that whether they're conscious of it or not, for many folks, alcohol it's a social lubricant. If I am anxious in social situations, it calms me down. If I'm depressed, well, a couple of glasses of wine and I feel better, and it's very socially acceptable, whereas cannabis is not. But I think when we get into the actual harms to our bodies and the potential effects of the two of them, let's do a side-by-side comparison. So we've got cannabis and alcohol. Cannabis, as we said, is not lethal, and alcohol is potentially lethal, and particularly, as you have touched on, when used in combination with some of the pharmaceutical options that are out there, correct?
Right, and I'm not sure most people are aware that alcohol is one of the largest killers of particularly men, into their 40s and 50s. So people that have been drinking for a while, doing damage to their liver, but also to their circulatory system. So, it is a real serious issue. I don't think that prohibition of it is the answer either, but learning to use it moderately is good. But obviously, cannabis is not doing the same sort of damage to the liver, the kidneys, the heart, and the brain that alcohol does.
And stopping using cannabis suddenly, you may experience some withdrawals, you may have some insomnia or some irritability, but it cannot be fatal to stop using it, even after you have been using it fairly heavily, whereas that is not the case for alcohol, correct?
That's correct. So with alcohol, for someone who's drinking heavily and is an alcoholic, there can be concerns that they might have seizures, fatally high hypertension, and those sorts of issues. So usually if someone went in for like a medical detox, they would be given, something like Librium to help them through that, so that they don't have a seizure and can get through that withdrawal period, which is, usually with that sort of treatment, you're looking at like a 5-7 days of being in a medically supervised setting just to getting through that detox part. And then, of course, treatment really doesn't begin until detox is ended. You have mentioned that the damage that alcohol does to many systems, the liver, the brain, the circulatory system. We are finding through many studies that cannabis actually is a cellular and neuroprotectant. That it encourages the mitochondria, which is the little battery in each of our cells, to get into gear and put out more energy, and so there is another difference. Cannabis is an antidepressant and alcohol is a system depressant. Can you talk to us a little bit about what that? I mean, we're not talking about alcohol will make you depressed in the mood sense, although it can, but it's doing something to our bodies, right? Right. So it basically depresses the whole neurological system. But I think that this is where those two sort of things of like, so someone's depressed, so they drink some alcohol, but that alcohol is doing damage in their body, creating also a new source of stress. So their amygdalas are firing, their cortisol is releasing like crazy. So in many ways, it really can contribute to depression versus alleviating it like we see with cannabis.
So just a couple of others here. Cannabis is an anti-nausea and an anti-emetic, which is it prevents folks from throwing up. And actually, one of the pharmaceutical uses for THC. Marinol is a pharmaceutical version of THC. That was its first use or application was to treat nausea in cancer patients. Whereas we know that alcohol can actually cause nausea and vomiting. And I want to talk about the fact, again, this gets to why you should not combine cannabis with alcohol because of how they both interact with our digestive system. Can you tell us a little bit about that?
So I think what you're kind of pointing toward here too, as well, is that if someone's highly intoxicated on alcohol and their body should be rejecting it, they should be having emesis or throwing up. If then they're smoking or ingesting whatever, the cannabis, it may stop that reaction from happening and keep those blood alcohol levels high, which is then just doing more damage. So.
And that can be very problematic, especially if the alcohol has caused you to pass out. Not a good idea to mix the two. And while people can develop a dependence on cannabis, and we'll talk a little bit about what that might look like later on, there has been no scientifically proven physical addiction in the way that there can be with alcohol and other substances. When I say when we say physically addictive, can you illustrate for us a little bit of what that looks like? What's happening there?
So I think with physical addiction, so like with alcohol, if somebody's physically addicted to it and they start going through the withdrawal syndrome that we mentioned earlier, they'll start shaking, their blood pressure starts to go, dangerously high. There can be sort of emotional, but also psychological issues as well. They can have hallucinations and delusions and those sorts of things. So that there's but these are physiologically based. Whereas with cannabis, you won't have that sort of extreme reaction. I think you mentioned, irritability, some issues with sleep. I've also heard that dreams can become more intense after someone stops using cannabis. But they're really they're not even comparable in their level of seriousness, I would say.
All right. Start low and go slow. This is a little message that is beginning to. I'm seeing it across the country in medical and adult use cannabis states. Start low, go slow. We would always recommend that somebody who is trying this for whatever purpose to treat whatever condition or symptom begin by using less than the recommended starting dose. And as we get more advanced with our lab testing, we're able to identify, particularly in edibles, how many milligrams of THC is in this cracker or, is in this lozenge. And for a newbie, for somebody who is not cannabis experienced, somewhere between 5 and 10 milligrams is a reasonable starting dose that should not be overwhelming. There are, edibles out there that are 100 milligrams. Right, and so, and when that comes in the form of a candy bar, when I see a candy bar, I don't think I'm going to eat one little square of that. I know I'm going to eat at least 2 or 3, right? If not the whole thing. And so it's very important to know as much as you can about the content of an edible. Now, in Maine, patients can trade medicine. They can, without any sort of payment being exchanged. So I know that there are folks who are, baking brownies and giving them to a patient who is a friend. And in that case, we might not know exactly what the milligrams per dose are. And again, go back to start low and go slow. If you don't know, take a very tiny amount and wait at least an hour because, it can take even longer than that for the effects to be felt.
I think one thing with edibles, too, is that it can affect you, and it's probably true with all the ways that you ingest, but it can affect you differently from day to day as well. So depending on what you've eaten, how well hydrated you are, your own sort of state of mind, where your whole body system is. Did you sleep well the night before or not? And so what worked yesterday, may be really different today, and to really keep that in mind.
That's a very good point. And again, we want to stay focused on the effects, and this is whether we're new to it or whether we've been, in a recreational relationship with the plant in the past. One thing that is different about therapeutic or medicinal use is your level of consciousness, I think, and awareness of what you're feeling and what is this experience like. We recommend that folks, especially when they're trying something new, keep that cannabis journal and really do every 15 minutes, do a little self-check when you're trying something new. Don't try it and, it's a night that you've got people coming over or you're going out. Use it for the first time in a space and a time frame that you'll be able to really give yourself the attention that you deserve, and to stay focused on how this is making me feel. And we've been touching on this throughout. It's so important that we remember that we are valuable, and even though we're depressed or even though we're anxious, we're worth moving. We're worth spending time on. And so I just brainstormed a few ways that are not terribly time consuming, many of them, and are just simple things to kind of start resetting. And I don't know if you have you actually have touched on some of these, Dr. Clark, already, but if you have anything to add to that or thoughts on just the importance of real self-care and how cannabis can be part of all of these things.
Right. So for the curriculum that I developed, actually for nursing students, we have a huge focus on self-care. As you can imagine, nurses are stressed. They work in stressful environments, and they actually tend to take care of everyone else at the expense of their own well-being and health. So I have years of supporting nurses in doing their own self-care, and of course continually working on it for myself as well. There's a lot of great information out there about how the first one on the list here, meditation, can really help to support your whole body and your well-being, including what we call your psychoneuroimmunological system. So, and people think, oh my gosh, I have to sit and be quiet, and it has to be for so long. And the newest data is somewhere between like 7 to 10 minutes a day of, sitting quietly, praying, repeating a phrase to yourself over and over. We might call that a mantra. Or even just being really present, like going for a walk, but counting your steps, and then being gentle with yourself in this process. So if you're trying to focus on your breathing, or you're trying to say a mantra to yourself, then just letting it go when those thoughts come in, because they will, and then going back to your area of focus. So what we have found is that helps to build stress resilience. It slows down that amygdala firing, gets us firing from our prefrontal cortex and the cortex part of our brain, and brings us into our parasympathetic nervous system being the driver. Something, you have stretching there, but yoga. So again, 7-10 minutes of yoga, and there's plenty of things you can find online. And of course, the main concern of that is being safe while you're doing that, and really focusing on your breath and being in your body and present while you're doing that. Can also help decrease that whole stress response. I like that getting offline as well. It is hard to do in our world and with our demands, and that's something I have to work on all the time because I teach mostly online. And so getting offline is an important thing for me to focus on. But remember also, I said that blue light really can mess with our endocrine system. And I think we'll probably be hearing a lot more about that in the near future as well. And I think everything you have on this list is really great. As far as affirming yourself, you can buy little affirmation cards. Last year I had a Louise Hay desk calendar that I would, every day you pull up a new affirmation, and you can carry that with you during the day or think about it during the day. And so some of these things also, there's a saying, you can change your brain to change your mind, and you can change your mind to change your brain, something like that. So kind of this idea of, the more positive we are, the more we're self-affirming, our brain structures can actually begin to change to move toward that. Or the fake it till you make it idea.
I love fake it till you make it. And I think that I tried to select things. I mean, something as simple as taking a drink of water. I feel that it can sometimes seem overwhelming to take that first step. I don't, coloring. Let's talk about coloring. It's a big craze. It's there's a resurgence, and I love it. But I find that for myself, I will open my favorite coloring book to a new page, and then I sit there and I freeze because I don't know where to start, and I don't know what color to start with. And if I let myself, I can work myself up quite a bit over coloring, which should be really relaxing. And I think just taking that first step, like fake, okay, I'm going to start with blue. Here we go. And not letting myself get so caught up in is this going to be right? Is it going to, be perfect, I think.
Stress is also all about our perception of stress. Remember earlier I said it's about that psychological, emotional. If you didn't like coloring when you were a kid and you still don't like coloring, then coloring is not going to be the answer for you. You could still try it, and maybe it's different now when you're adult, but doing what you're comfortable with too is what's really important, while also maybe trying some new and different things as well. And I think what can happen when you're depressed is that you can really get in sort of a negative cycle and not really be thinking about trying new things. You're overwhelmed with just trying to get through the things that you need to do right now to get going. But something really simple like coloring, and I think one of the reasons why it's such a big craze is they're showing it to be really effective as like a meditative experience, and to get that parasympathetic nervous system activated so that amygdala isn't firing as much, and our cortisol levels are lowered. And so I do the coloring thing too, and I have that I've got to finish this by a certain time, and I will tell you my Christmas one is still not quite yet done. and choosing the colors and staying in the lines. But on the other hand, it's really a great opportunity to reflect on, so what if I did go out of the line? So what if it's not perfect? There's that balance between perfection and imperfection, and just acceptance of it is what it is. Mm-hmm. And then moving on to the next thing as well.
Right. All right. Well, speaking of that, we do want to talk about, cannabis can be very powerful for folks who are dealing with anxiety and depression and stress. They can, in some cases, make some of the suggestions on that last slide more enjoyable even. But even though it is a very, very helpful plant, even though it is not addiction forming in the way that pharmaceuticals are, some folks can develop an unhealthy relationship with it. And I think we need to be honest about that and realize that can happen, and it's okay if it does. But I wanted to throw some ideas out there to help folks recognize when they might need to rethink their relationship with the plant. And so I will see if you have any things to add to this or comments to make, or do you see folks that you work with running into this? Do your nursing trainees find folks who have problem relationships with the plant, or is it more that if somebody has an addictive I've heard, if you have an addictive type of personality, you will find something to be in an addictive relationship with, whether it's cannabis or food or people.
Right, so I would agree with that. So oftentimes people will take, they'll talk about like addiction substitution. So they'll be addicted to one thing, they'll stop doing that, and then they'll become addicted to the next thing. And I think we need to think about our ideas around addiction, attachment, aversion. We could almost look at that from a Buddhist perspective, but that's probably a different a different topic. Yes. I mean, it sort of is in our human nature to be attached. either be very attached to things or very averse from things. And that's what Buddhism says, is that that's part of our human nature. And in our culture and society too, we look at people with addiction, and we still, even though it's a brain physiological issue, we still tend to stigmatize them, look down upon them, think of it negatively. Sometimes, what I do hear from my students, so we actually talk about cannabis in our pharmacology class, and for most students, most nursing students, this is their first introduction to really learning about how it works in the body, how it helps to support homeostasis in the body. And, what I hear from, certain ones of students, usually it's somebody that they know or a relative or someone they grew up with in their household, and they saw cannabis, they saw the person as being addicted to cannabis and as them not really kind of losing their motivation and that sort of thing. So that's kind of what I hear from students, as they get concerned about that. Is somebody who's using cannabis going to become, addicted or lose their motivation? And, I think that could be a risk, but the numbers I've heard is it's, around 10% and it's or less, and it's far less than with alcohol or other medications like the opiate medications and so forth. So, and I think it's about balance and doing these other things with your life as well. So using the cannabis is almost, I would say, a gateway to changing your life and how you want to live your life differently. So
a positive gateway. Yes. Exactly. So, but I would say that if you are finding that you're using cannabis to avoid social situations or making excuses to not get together with your friends because I want to stay home, maybe by myself and consume this stuff, or using it, as a way to avoid self-reflection, rather than a way to enhance and make self-reflection safe. And overindulging or overdosing regularly, these are signs that it's time to reach out to someone. And you pointed this out at the beginning. A good first step, if you see that happening or feel that that's happening in your life, is to just take a little 3-day break. Maybe you've been using more and more cannabis because the strain that you were accustomed to doesn't give you the same effect anymore. So take that 3-day break, and then come back to it. Start low again, micro dosing, and go slow. And then if it still is a problem for you, or for someone that you care about, then maybe it is time to reach out to your physician or to someone who can assist. So. All right, well, that brings us to the end of our slides, and we want to thank everyone for their time and their attention. Do we have any questions or concerns from our audience? Producer Ben. Producer Ben is saying, no, we do not. So that's awesome. Dr. Clark, I want to thank you again, really, for coming out and joining us today. Is there anything that we've left out or that you want to say before we wrap up here?
I do want to say, I want to let people know that I think sometimes when people have depression and anxiety, it feels like it's never going to end, and that there is no hope for them. And of course, that can lead to things like suicidal ideation and that sort of thing, and to reach out for help. And there is help out there. And there are people that use cannabis and even other medications as well, but obviously we're here talking about cannabis, and they do experience recovery from depression and anxiety as well. And so to really strive for not giving up that hope and for reaching out for help.
Wise words, wise words. Thank you so much for joining us, Dr. Clark. I'm Becky DeCoyster with Wellness Connection of Maine, and this is Producer Ben helping us to sign off. Thanks for joining us for this edition of the WCM webinar series.